It's the Chris Salcedo Show, and welcome to Hour 2, my friends. Telephone number here is 281-558-5738, 281-558-KSEV. We all remember the dark days of the China virus, when our government turned against us, when our government attacked our rights in an effort to do a power grab, used our fears to get us to abandon what it is to be an American. And somebody was on the front lines, literally and figuratively, of this battle. Joining me right now, you probably recognize the face. A lot of you folks are going to go, those of you in Houston are going to know her right away. Dr. Mary Talley Bowden, she's a board certified, oh boy, I can never pronounce this. I'm going to go very slowly. Oto-laryng-ologist and sleep medicine specialist in Houston. I probably screwed it up. She is the founder of BreatheMD, a direct care ENT practice focused on sinus and allergy and airway health after gaining national prominence for threatening thousands of COVID patients, or treating, I should say, not threatening, treating thousands of COVID patients early in the pandemic. She founded Americans for Health Freedom and authored the new book, Dangerous Misinformation, the virus that the treatments and the lies. It is a book I'm so excited has come out. And Dr. Bowden, welcome back.
Great to see you. Thanks for having me, Chris.
I want to talk about the book here in a few minutes, but I want to set everything up so everybody knows what you've been through, how we got here. Remind the people of what vaulted you into the national spotlight.
Well, I'm an ear, nose, and throat doctor, and I started seeing and treating COVID patients. My wheelhouse is a respiratory tract infection specialist. And I had privileges at Houston Methodist Hospital. They were the first in the country to mandate the shots. So they did that 5 months before Biden. They paved the way for the rest of the country. And I just started speaking out against the mandates, and they attacked me pretty hard in return. So they suspended my privileges. And I found out through a reporter texted me from Houston Chronicle asking me to verify. And I did a double take. I'm like, I don't know what you're talking about. And the next thing I know, I have CNN calling me and, Washington Post, and they tweeted that I was spreading dangerous misinformation, hence the name of my book. That made me sort of infamous. And I just decided to fight back really hard. My 15-year-old asked me yesterday, he said, Mom, were you ever bullied in high school? I go, No, not actually until my 50s, until I turned 50. and I am going scorched earth.
Good girl. I am proud of you for doing that, because thank goodness somebody was standing up for us, because it turns out, and we're going to get more into that in a minute, it was the government lying. It was the government spreading misinformation and disinformation. How did the Texas government medical establishment treat you? Did you have support there, or did they attack you as well?
Well, it's been on both sides. So yes, I've definitely gotten some great support. Steve Toth passed a resolution honoring me in the Texas legislature. But on the flip side, I'm still tangling with the Texas Medical Board. They're still after me. And, I could have just folded a long time ago. That probably would have been the sensible thing to do. But I am fighting on principle. I tried to help a dying man obtain ivermectin, and we used the court system to do it. It wasn't me, acting in a rogue fashion. But their reprimand, they issued a public reprimand against me for my efforts to save this man's life, and ultimately, unfortunately, he did die, and he never got the medication that he wanted. But so I'm still battling the medical board, and I'm actually going to court after this with Houston Methodist, because, I sued them for defamation. I lost on a technicality. My attorney actually had a stroke during the whole thing, and he made an error that we couldn't recover from. So I wrote them a check for $166,000, which they cashed. And now they want interest. So we're going to court today to discuss that.
Good grief.
It's never ending.
Good grief. Dr. Mary Talley Bowden is our guest right now, folks. The name of the book, Dangerous Misinformation, the virus, the treatments, and the lies. Many don't know that you actually successfully sued the Food and Drug Administration over ivermectin, an award-winning medication, by the way. How crucial is it that doctors maintain this ability to practice medicine and use off-label applications for medications?
Well, thank you, because that's a huge win. It's so hard to sue the government and actually succeed. So we're very proud of that. And basically, in March of 2021, the FDA issued something on their website, basically telling doctors you cannot use ivermectin to treat COVID, and telling patients you should not take ivermectin to treat COVID. And then in August, late August of 2021, they put out the horse tweet, the infamous horse tweet where you have the blonde woman nuzzling a horse. And the caption says, seriously, y'all, you're not a horse. You're not a cow. Stop it. Well, they in court, they said this was just a little quip. Well, that it had dire consequences. I mean, I can tell you firsthand, I had a very hard time getting my patients access to this very safe medication. I've never seen anything like it. We had people stockpiling this medication because it was so hard to get. And they're not, the FDA is not allowed to tell doctors how to use the medications. Their job is to approve the medication and move on. They're not supposed to butt in clinically. And they're not allowed to tell patients what they can take and what they can't take. So we sued them over that. They crossed the line and we won. And they had to take down the misinformation. And, unfortunately, I don't know how much of a true impact it has made other than keeping them hopefully from doing that in the future. I think the FDA, the current FDA, needs to issue a public statement stating how safe ivermectin is. And I think they need to make it over the counter for everyone, because there are, Texas is one of the states, one of the 5 states that has made it available without a prescription, but it's still super hard to get. I mean, most pharmacies will not dispense it.
Well, see, and you've hit a nerve on ivermectin in particular, because also members of the fake news press were also complicit in this. For those of you who don't know or missed this during the China virus, ivermectin, yes, it is used in big doses for horses as a dewormer. It is used there, but it is also used in human doses and is an award-winning medication in that application for humans. And the folks at Fake News CNN, the folks over at Fake News MSNBS, and all these fake news operations neglected to say that second part because they politicized medicine, and it chapped my hide. And I think that this is just my opinion, Mary, but it is my opinion that those in the left-wing press put people's lives at risk by misrepresenting what that medication was. Did they not?
Oh, definitely. And you'll remember they went after Joe Rogan. They turned him green. They put a green filter on his face to make it look like he was sickened or poisoned by ivermectin. Even recently, there was a reporter at Vanity Fair who cozied up to me. She acted all nice to me, and then she wrote an article. She wrote a hit piece, and she called ivermectin horse dewormer. This is in 2025. Her name is Catherine Ebon. So it is still going on. That's why I think it's really important that the FDA should come out and just correct the record and rebrand ivermectin, because it is super safe. I mean, I really dug into the safety before I used it. I found the original study that Merck had to submit to the FDA that showed toxicity data. And you have to give enormous amounts of that drug to hurt somebody. And I also couldn't find anything in the literature about accidental or intentional overdose from ivermectin, where you can find thousands of papers about that with Tylenol.
Yeah.
So it is incredibly safe. And if you think it doesn't work, that's fine. But let everybody else have access to it.
Any medication that you take in massive quantities can be dangerous. I mean, it's common sense and it's science. And we were forced to abandon science and common sense and our own health because of left-wing nut jobs, as I mentioned earlier, undertaking a power grab. And that includes, in my opinion, the Texas Medical Board as well. Dr. Mary Talley Bowden is our guest right now, folks, and she is the author of Dangerous Misinformation: The Virus, the Treatments, and the Lies. The book, it was, in my opinion, and it's not my opinion, this is a provable fact, the government was partaking in a misinformation campaign. Tell me one of the big points that you make in the book about government, the left-wing press, or whoever who was trafficking in the real misinformation during the China virus.
Yeah, I mean, a lot of people have regrets over taking these COVID shots. And I always tell them, you are under tremendous pressure. The Biden administration doled out $11.5 billion to influencers to spread the safe and effective narrative. I mean, that's an enormous amount of money. And, you know, the date that they launched that program was the exact same day that Houston Methodist declared they were mandating the COVID shots. I do not think that's a coincidence. It started in Texas, and it started in Texas for a reason, because they knew if they could get away with it in the freedom-loving state of Texas, they could get away with it anywhere. And Greg Abbott was part of that effort, I am certain. Wow. But yes, there was massive propaganda, and our tax dollars went towards that.
I was digging up a soundbite that I know I had about what you just talked about the misinformation, the safe and effective narrative. And it turns out, we found out in congressional testimony, and this is quite long, but I think folks ought to hear it, just to put the exclamation point, folks, it was your government that was partaking in misinformation. And by the way, nobody's been prosecuted for the deaths they caused by this misinformation, because government gets to kill Americans apparently with impunity. Listen to this, Dr. Bowden, and I want you to comment on it, if you will. Listen to this.
Now, one of the big issues on top of this is the fact that so much of the misinformation that came out during COVID was actually fostered by the federal government, in the sense that we actually had the federal government colluding with social media companies to discourage scientific opinion that went against what was the stated mandate at the time. And so, to help clear the record, I'd like to ask you all a couple things. And the mantra at the time was to stop the spread. And so we were understood that we either did not receive it or could not transmit it when it was released. Could you speak to that, Dr. Jernigan? Can you receive it or can you transmit it after receiving the COVID-19 vaccines?
Yeah, I think having worked at CDC for 30 years and seen the benefits of vaccine, you know, we have to make the best recommendation.
Can you transmit it or can you receive it after receiving the COVID-19 vaccine?
We need to make the best recommendations that we have.
That's a yes or no question. It's very simple. Commander Grimes, can you receive?
I think we make the best recommendations for the public. As
can you still get COVID after getting the COVID-19 vaccine?
Yes.
Yes.
Yes. Okay.
That's correct.
Does it prevent you from transmitting it?
Although it may, there's data that shows that earlier in the pandemic, there was some reduction in transmission. The data on that are very challenging to pin down, but it does not absolutely prevent transmission. So
it does not prevent transmission. Thank you very much.
So Dr. Bowden, a vaccine stops, a true vaccine anyway, not a gene therapy with the China virus. Dr. Robert Malone informs us, with the China virus medication, this so-called, it's a gene therapy, not a vaccine. But anyway, the narrative of safe and effective, the narrative, it stops transmission, it stops you from getting it. It was completely blown out of the water. The government was the main purveyor of misinformation, yes?
I mean, most certainly. It's really difficult to listen to that exchange, because basically, if it doesn't fit the narrative, they're not going to. It's not about science. I mean, it's in, you know, I was seeing all this firsthand. Initially, I didn't see the injuries initially. I just saw that it wasn't working, and I was working with Methodists, and you know, they were sitting on all this data, right? As the first hospital in the country to mandate the shots, they had a ample data, and you know, funny enough, they have not shared that, right? How many of their employees did not get sick after they made them take these shots? They never shared that data. And you know, if the data had fit the agenda, they would have had it on billboards. But of course, they're very quiet about it.
Yes, and booster after booster after booster after booster, and then how many times did Beijing Biden get the China virus? Oh, he's got COVID. Oh, he's got COVID. That guy was the most boosted cat on planet Earth, and still kept on getting the China virus. Dr. Bowden, last question I have for you. Not just focusing on government. I'm sure you go over it in the book, because the last section, by the way, the book, folks, Dangerous Misinformation, the Virus, the Treatments, and the Lies. The biggest lie, the biggest whopper, I know you're going to list a whole bunch of them in the book, but the biggest whopper that so offended you as a scientist, offended you as a medical professional, offended you as an American, the biggest lie that you see that was told during the China virus pandemic?
Oh, yeah, that's hard. I think on a personal level, it was, you know, we had these bureaucrats dictating treatment decisions for all Americans that were not seeing anything firsthand. I mean, they were in their bedrooms over Zoom calls telling the public, okay, this is what you do. This is how you treat this novel disease, and not giving doctors any, just basically neutering doctors who were there firsthand. I mean, even in the hospitals, they were subjected to these strict protocols. They were not allowed to deviate. And for me, they attacked me viciously because I chose a path different from the public health agencies. And that's just a frightening thing that we haven't corrected that.
Yeah.
Other than pushing back on the FDA. We haven't corrected that. We need to empower physicians again, because so many physicians are employees. They're not allowed to speak out. They're not allowed to do the right thing when the right thing is difficult to choose. The right way is a difficult way to choose. I was fortunate because I'm not employed by anybody. I don't contract with the government. I don't contract with hospitals. I don't contract with insurance companies. I mean, I call myself third party free. And the only people I work for are my patients. And that served me very well during the pandemic. In some ways it hurt me, I guess. But, that's what we need is, disentangling ourselves from these bureaucrats that don't treat patients.
As long as Obamacare exists, we're not going to be able to fix it because it's consolidating. It's making our doctors employees of these massive conglomerates. And medicine is the last thing on their mind. It's PR and spin and narrative, as Dr. Bowden was telling us. Folks, if you want to pick up the Dangerous Misinformation, the virus, the treatments, and the lies, brand new book, Dr. Bowden, where can people go if they want to get that book? I mean, is it out yet or is it on pre-order still?
It's on pre-order. You can buy it directly from the publisher, which is Post Hill Press. You can buy it off Amazon, Barnes and Noble. But the more copies I sell now, the more likely we can make it a New York Times bestseller, and that's my goal because we've had a few reach that pinnacle, but they're not the ones that are telling the truth. So, and we still need to get this truth out. It's very important so that this doesn't happen again.
And where can folks reach you on X, on an email you want to give out, or a website you want to give out?
Yeah, I'm very active on X at Mary Bowden MD. I have a Substack as well. And I've also started a podcast. And my nonprofit is Americans for Health Freedom, where we give public support to politicians who are willing to state the COVID shot should be pulled off the market, because I feel like that's a very important litmus test. We have growing support. It keeps growing with bigger names. Chip Roy just signed our pledge. We have about 10 people running for state governorship that have signed this pledge. And we just need to keep speaking out because it does not appear that the current administration is interested in fixing this problem. COVID is a festering wound. It has not healed. It's not going to heal by ignoring it, which is what they're doing. So we must continue to speak out.
Dr. Mary Talley Bowden, folks, the name of the book again, Dangerous Misinformation, the virus, the treatments, and the lies. It is available on pre-order right now. Get your copy and make a difference and learn what really went on. Doctor, it's great to have you. Thank you very much for all of your efforts, and thanks for staying tough. Appreciate it.
Thank you, Chris.
All right. Telephone number is 281-558-5738. 281-558-KSEV. So long as we have Obamacare, folks, there will be no fixing the medical problems in this country. And you can thank Republicans and Democrats for, again, another failure, imposing socialism that doesn't work and continuing to triple down on it. And who are the victims? You and me.